Over the past decade, the prevalence of mental health and associated treatments has increased worldwide. This is a wicked problem. According to the World Health Organization, 1 in 5 individuals will experience mental illness at some point in their life. This is a significant amount of people. Mental health refers to the state of well-being in which an individual has the ability to cope and manage normal stressors of life. When an individual can no longer cope with the normal stressors of life and finds themselves in distress, a decrease in their mental wellness can occur. It is required by the Canada Health Act that all Canadians have equal access to mental health services. However, challenges related to accessibility and the stigma surrounding mental health pose a threat to receiving adequate care.
We have come up with 4 potential recommendations that could enhance the way mental health is discussed and dealt with worldwide. Our recommendations will discuss the stigma surrounding mental health, ways in which mental health should be discussed in early life, promotion of increased accessibility of mental health services, and advocacy for housing and employment opportunities for those suffering from mental illness.
Our first recommendation is the implementation of mental health education into family services and community-based programs to reduce stigma. The stigma around mental health and illness prevents individuals from accessing healthcare services. We see negative ideas about mental health through individuals, communities, and even in the media. By providing education through community-based programs and family services, it will help lower the stigma not only in the community but also at home. As stated previously, media strongly influences how we think about mental illness, but we can use the media to our advantage. Social media can be used to reach a wide range of people and provide engaging knowledge about mental health. It can also be used to provide social support for those suffering from mental illness and let them know they are not alone in this fight.
Our second recommendation is the implementation of mental health programs in the school system focused on children's mental health programs. A school-based program will provide treatment options, counseling, and early screening that would otherwise not be accessible. This will provide a financial advantage because it will prevent expensive inpatient hospitalization or residential treatment in the future, which would save hundreds of thousands of dollars per child per year. Another option is providing a program for transitioning youth into adulthood who are diagnosed with mental illness. Poor transitioning leads to higher school dropout and suicide rates, increased homelessness, unemployment, and criminal justice involvement. With programs in place, less adults will require service and a more stable and productive mental health population will result.
Our third recommendation would be to promote increased accessibility through creating more mental health service access points within the community. This would involve shifting care away from large psychiatric hospitals and developing more community-based services, such as integrating mental health services in with general health services. This would require collaboration with healthcare providers in general health service centers like clinics and hospitals to enhance their knowledge on mental illness to provide better care for their patients. By making resources widely available, it allows for individualized tailoring of treatments that would result in positive outcomes for patients in the future. Individuals with mental illness often require more than one health service provider, and since treatments cannot be easily predicted or planned, access must be readily available.
The final recommendation is to advocate for expanded housing alternatives and employment opportunities to enhance the quality of life among those diagnosed with mental illness. This is through uniting the local and provincial government and working collaboratively to support community housing. Community housing allows health services and social services to link together while providing individuals with poor mental health status adequate housing and mental health services. We know that mentally ill patients are able to live independently as much as members of their own community if we give them a chance. Assertive outreach programs in the community can provide a positive healthcare experience for patients, and studies have shown that providing housing is linked to faster recovery.
By reducing stigma, this allows for mental illness to be better understood, which in turn can lead to better treatments and interventions. By introducing discussions on mental illness early in life, we can promote a safer, more welcoming community for individuals who suffer from these illnesses. Promotion of community-based access centers for mental health services would allow for less wait times, more availability, and easier maintenance of illness. The quality of life of people suffering from mental illness can be improved greatly if they are capable of being independent in their community. We believe that these 4 recommendations are not out of our reach. With adequate interdisciplinary collaboration, we can achieve these goals and improve the way mental health is viewed and accessed.